There are a few things that make a good bioenergetic therapist, but knowing a whole lot about character structure is not really one of them. In fact, I'd argue that in most cases, character assessment is just a parlor trick to make therapists feel clever, because leaning too heavily on it will actually give a therapist giant blind spots that can undermine their real job. Hey everybody, my name is Leah Benson, and I'm a licensed bioenergetic therapist, coach, and psychedelic guide in Tampa Bay. And today I'm going to break down some of the mystery of reading a character and explain why knowing a whole lot about the conceptual intricacies of character structure, as it's known in bioenergetics, isn't what makes you a good bioenergetic therapist. First off, in case you're not exactly sure what character structure is, simply put, it's a method of diagnosis that therapists trained in bioenergetic therapy use. They do something they call reading a person's body by noticing a client's typical patterns of breathing, movement, and tensions, and kind of how much energy they seem to have in their body. And then, based on those traits, they make a bunch of assumptions about the types of struggles they think a person went through in early life, and that they infer are causing that person to navigate and make sense of their life and the world in particular ways right now. It's not really different from what any therapist does when they're meeting with a new person for the first time, or the first few times, really. They're trying to get a sense of how the person sees themselves and the way they approach life, not only by what the client tells them, but also by noticing how the client is approaching the therapist, the therapy, and the assessment process itself. The basic idea is that everything the client brings into the room is valuable information that will help the therapist get to know the client so they can help the client see what's getting in the way of them getting what they want for their life. So noticing the body stuff, the character analysis, is just another aspect of information gathering that a bioenergetic therapist does. But the problem with character analysis is that because you can see specific patterns of movement or tension in a person's body, if you've been trained in bioenergetic analysis, you are likely to think you can essentialize those traits as corresponding to specific psychological phenomena or ideas that cut across all people. For instance, I heard a teacher say once, all muscle tension is fear, which, as anyone can surmise, simply isn't true in the least, even if you're dealing with people who are coming to therapy because they have had fearful things happen in their past. And while it's absolutely true, the patterns of breathing, movement, and tension in a person's body are the physical representation of how the person conceptualizes the world, because as modern cognitive science makes very clear, concepts are plans for action. It is absolutely not true that those patterns represent out of context, identifiable ideas that a person has about themselves or the world. There is simply no one-to-one correlation between conceptualizations and body shape, size, tension level, etc. Because bar none, variation is the norm, even in the same culture. Yes, all children go through a similar trajectory of physical and cognitive development. And sometimes people will relate physically to the world in ways that one might assume a child at a particular phase of development would. But the specifics of how and what those people are thinking and how they are conceptualizing themselves and the world at those moments are going to be unique. Which leads to the real problem with relying too heavily on understanding character structure as taught in bioenergetic trainings or in books on character analysis by Reich or Lowen, or anyone who came after them. If character analysis becomes something more than a gist level entry point for seeing how a person approaches the world, then the therapist is breaking one of the most basic rules of doing their job, which is not making assumptions about who a person is before getting to know them. Because part of the skill of a therapist is being able to meet with a brand new person and sit in the vast ocean of what my own psychoanalyst called the not knowing, which is a giant part of what we as therapists are actually supposed to be doing and showing our patients how to do. Sit in the not knowing. So yes, a good therapist may start with a gist level idea of how the person in front of them is going to approach the world, the therapy, and the person of the therapist. But as soon as they make that assumption, a therapist who is doing their job well is going to start looking for evidence of how the patient isn't demonstrating the characteristics that they've assumed about them. And they will certainly not be attributing specific psychological concepts to those typical patterns either. Because therapy is not about therapists finding evidence for their models. It is about helping patients uncover how they see and do themselves in the world so they can decide if those views and those ways are working for them or not, and then alter them if they want to. Which means, bottom line, if you start hearing about character structure from your therapist as a way to understand yourself, you might want to consider whether you are in psychotherapy or astrological consultation. Because in my opinion, you might just be getting something other than therapy. So buyer beware. We'll see you next time.